And now for our last slide, some final conclusions to remember. The diagnosis of pneumonia should be suspected in a patient with cough, fever, pleuritic chest pain, and tachypnea, as well as new infiltrates on chest x-ray. Special clues on chest x-ray that may help you identify the etiology of pneumonia include 1. Lobar pneumonia being most commonly caused by strep pneumonia, which is as well the most common etiology for community-acquired pneumonia. If you see diffuse interstitial infiltrates, suspect either PCP, TB in a patient with HIV, or atypical pneumonia. If you see right upper lobe infiltrate, suspect tuberculosis. And if you see a right lower lobe infiltrate or consolidation, think about if the patient has risk factors for aspiration pneumonia. 3. Use the CURB 65 score to determine the need for admission and to determine appropriate antibiotic therapy. 4. Early change to oral antibiotics may reduce cost of care without impacting outcomes, and this should be evaluated on a daily basis in a patient hospitalized with pneumonia. 5. Patients with community-acquired pneumonia, especially due to strep pneumonia, even if they're admitted to the ICU but are responding appropriately to antibiotics, can be treated with simply a 5-day course of antibiotics. 6. Always consider pulmonary tuberculosis on the differential diagnosis for community-acquired pneumonia, especially if no improvement is seen after antibiotics or in a patient with HIV infection. 7. Cardinal features of aspiration pneumonia are acute onset of symptoms, a right lower lobe infiltrate, and a patient who is in a coma, has dysphagia, or has been vomiting. These patients should be treated with either augmentin or IV ciprofloxacin or IV clindamycin. And 8. Hospital-acquired pneumonia is a serious cause of morbidity and mortality in resource-limited setting and is treated differently for patients who are not ventilated, who have early onset of symptoms, less than 4 days, or late onset of symptoms, more than 4 days after hospital admission. Most common treatment for patients with early onset hospital-acquired pneumonia and who are not ventilated is ceftriaxone, but the treatment should be prolonged to 7 days. And the most common treatments used for patients with late onset hospital-associated pneumonia are anti-pseudomonal penicillins or quinolone, and you should consider adding an aminoglycoside in severely ill patients. Thank you very much. I invite you to now take the quiz associated with this lecture, which will test your knowledge. Thank you.